Welcome to Pet Health in Detail. If you're new to this channel, I'm Shannon Yehudi, a registered veterinary nurse with over 19 years experience. This channel is all about diving into more detail about your pet's care. I'll go over different disease processes, treatments, and tips so you can make educated decisions about your pet's health. Don't forget to subscribe to get notified when new videos are released. All right, hi guys. Today we're going to talk about wellness care for dogs. An ounce of prevention is worth a pound of cure. I'm sure you guys have all heard that, and it's absolutely true in veterinary medicine. So today we're going to touch on a few of just the typical wellness things. So we're going to talk about vaccines, heartworm, fecal and parasite, blood work, and fleas, and dental care. All right, so we'll start with vaccines. So the main core vaccine for dogs is often called DHPP, and it stands for distemper, hepatitis, parvo, and parainfluenza. These are all very contagious diseases that can actually be fatal to your pet. So based on their age and the area that you live in, your veterinarian may recommend giving these vaccines every 6 months, yearly, or sometimes every 3 years. So the next vaccine we want to talk about is leptospirosis. So leptospirosis is a bacteria found in water that's contaminated by infected wildlife and livestock. So based on where you live, this vaccine may be given every 6 months to a year. Symptoms include vomiting, diarrhea, but kind of everything does. So it's hard to diagnose early enough oftentimes. Lepto can actually lead to liver and kidney damage, which can end up being fatal and or irreversible. So it's very important to vaccinate these animals for that in the areas where it is a concern. So talk to your veterinarian and find out if lepto is a concern. And then we got rabies. Everybody kind of knows what rabies is. In a lot of states, it is required to vaccinate by law. And typically they do that every 1 to 3 years. And then the last most common vaccine is called Bordetella. So Bordetella protects our dogs from kennel cough. Typically this vaccine is given based on your pet's lifestyle. So are they in environments where there's around a lot of other pets? So boarding, grooming, puppy classes, things like that. Kennel cough doesn't tend to be fatal, but it is highly contagious to other dogs and can lead to additional respiratory problems. Okay, on to heartworm disease. So heartworm disease is passed by mosquitoes. If you have mosquitoes in your home or around your home, your pet is at risk for heartworm disease. And unfortunately, this disease can go undetected for a while. Basically, heartworm disease causes damage to the heart itself. You'll see in this picture, this heart is full of adult heartworms, basically strangling this heart. Untreated, you can see major fluid buildup in their abdomen, respiratory distress, and even sudden death. Treatment for heartworm is super expensive, but prevention is super easy and affordable. So prevention basically just consists of a monthly heartworm tablet, or you can even talk to your veterinarian about an injection they do every 6 months. For more information on heartworm disease, visit the Companion Animal Parasite Council at capcvet.org. Let's talk about fecal testing. Gross, I know, but all pets can become infected with worms and parasites, even indoor dogs. Most indoor dogs still go outside for walks and to go potty, and basically when they step in grass, puddles, mud, or even stool, they'll then lick their paws, and that's that main way of transmission for these parasites. Parasites can cause diarrhea, along with many other issues like anemia, which can be life-threatening. And fecal testing should be done every 6 months to a year. Also, many monthly heartworm treatments also provide treatment for a lot of the internal parasites that we have to be concerned with. All right, on to fleas. I know, another gross topic. But fleas actually like clean fur. They actually like clean environments, just like lice and people. So don't be embarrassed if your pet has fleas. It's easy to treat. Let's just get it done. A few misnomers that people often will hear in the clinic all the time. The first one is, my pet's only indoors. It never goes outside. Well, if it's a dog, it probably does potty outside. Most dogs do. But the biggest thing is, in most areas, it just doesn't get cold enough for long enough to kill off the fleas and their dormant eggs. And we can actually bring in fleas on our feet. So when we walk in the grass, we can bring them in. So even our indoor pets can become infested. The other misnomer that I'll hear all the time is, well, I'm not getting bit. Well, fleas actually don't like people. They prefer to hide on your pet and feast off of your pet. So basically, if you wait till you're getting bit, you're typically going to be dealing with a major infestation. So how can you tell if your pet has fleas? Well, the biggest signs is going to be itching, typically at the base of their tail and lower abdomen. When you pet your animal, you may actually get what we call flea dirt, and it's just these black little spots, or they'll end up on the table. You can actually test that dirt to tell if it's actually dirt from rolling around outside or if it is actually flea dirt. So what you do is you take that dirt and put it onto a paper towel, and then just drip a few drips of water, and then just kind of squish it on that paper towel. And if it runs pink or red, if you see pink or red lines, then that's flea dirt. And it's basically the stool of the flea. Also, if your pet is getting secondary skin infections, then that could be a sign that we're dealing with a flea issue. And again, hopefully that's what it is, because other skin issues are a much bigger deal to have to deal with. All right, so how do we fix the problem? So honestly, prevention is number one here. Fleas, like most issues, are more expensive and harder to control than just preventing them from even happening. So don't wait until it's a problem if you can. How to treat. So there are treatments out there that are typically, most of them are monthly treatments, and there are some out there that are every 3-month treatments. We recommend getting them from your veterinarian. These veterinary products tend to be oral, and some may be topical, so the back of the neck. But I personally have seen the oral products work a lot better. I do not recommend using any of the grocery store brands. So basically, it's old technology. It's just out-of-date treatments, and they actually have an increased rate of reaction, and they don't work as well on the fleas now. So there's no point in wasting your money doing that. We've got to make sure also to treat all the dogs and cats in your home. So everybody needs to be on a flea treatment to take care of an infestation. When you treat, if you've got fleas and you're starting to treat, you will see probably a drastic decrease in the amount of fleas and flea dirt that you're seeing right away. Now, within 1 to 2 months, don't fret, it's okay, but you will see more fleas. What's happening is the eggs that are in your home have now hatched, and they need to go through that life cycle. They need to be out of their eggs to actually die from the treatments that you've given your pet. But keep up with the treatment. It takes at least 3 good months to get control of most infestations. Also, if you see one flea, there's a ton more fleas and live eggs that you can't see. Just know that. All right, let's talk about blood work. So the physical exam can tell your doctor a lot about your pet, right? But it really can't tell them exactly what's going on with all of their organs. Blood work is just a great diagnostic tool to get a more complete picture of what's going on inside your pet's body. It's most important in older pets, so we can monitor changes. A lot can change in 6 months' time. It's also important to do blood work when they're on certain medications and also prior to most surgical procedures. For more information on pre-op blood work, I have a video dedicated to that subject, so I'll leave a link up and below in the description. All right, on to dental cleaning. So why is dental health so important in our pets? Other than just having bad breath, There's a lot more to it. So dental disease can be very painful. So if you think about the last time you had a toothache, probably it was just one tooth. And imagine when you look in their mouths, how many teeth are hurting. Also that bacteria. So all of that tartar, all of that crap on their teeth is bacteria. And basically they're swallowing that bacteria in their saliva all day long. It actually gets into their bloodstream and can cause major heart, kidney, and liver disease. And so it actually can shorten their lifespan if we don't take care of that. Also, the expense goes up. The worse their teeth are, the longer it takes to clean, the more extractions they'll need. It's just going to cost more if you wait until their teeth are pretty bad. So how do we know if your pet needs a cleaning? Well, first of all, lift their lip. Take a look. We're going to look for red inflamed gums. We're going to look for loose teeth, that heavy tartar buildup I was talking about. A couple other signs would be drooling or pawing at the mouth. That's actually typically a pain sign. And then a loss of or just a decreased appetite can be a sign that they're needing a cleaning. All right, so dental cleanings are a full anesthetic procedure. Unfortunately, they won't lay there and let us get in there around each tooth and do what we need to do. Once they are anesthetized, each tooth is examined thoroughly with a dental probe and x-rays, as well as scaled, cleaned, and polished, and then extractions as needed. One thing to know about after the cleaning, dental will build back up. There's nothing we can really do to stop it all together, but there are some things that you can do at home to at least slow this from happening. So obviously brushing is best, right? Recommend you can use any toothbrush, but definitely need to use a veterinary approved or an animal approved toothpaste. That is real important. Human toothpaste is not a good idea. Even if you can only brush 2 or 3 times a week, that's better than nothing. With dogs and cats, when brushing their teeth, typically, as long as you're starting out with a fresh, clean slate, you can just clean the outsides of their teeth. You don't have to get on the insides. The inside tartar doesn't tend to build up unless the outside is real bad. Then it starts to build up on the inside. So that can make it a little less stressful for you and your pet when brushing. And there's a few other options too. So there are dental chews out there, which are great. There is actually food and water additives. So they're basically just add it to their water bowl or sprinkle it on their food. One thing you want to watch for with these though, is you want to look at the ingredients and make sure there's no xylitol. Xylitol is toxic to our pets, and they say it's a small enough amount of xylitol not to be a concern, but we don't need to give that to our pets. It's toxic, let's not. So just watch for that. There's actually sealants that you can apply. So it's like a sealant gel that you can apply once a week to your animal's teeth that can help the tartar from not adhering to the teeth, basically. And then there's also dental diets out there. I know Hill's Science Diet has their TD food, and basically they're giant chunks. They have small bites, but they're giant chunks for a small dog too. The idea with a giant chunk is that the animal can't just swallow it down. It needs to actually chew it. And the other thing with these chews is the way they break when they're crunching them. They actually have a brushing action for the tooth, so it can be helpful for keeping tartar away. One thing to be aware of though is bones and super hard toys will break teeth. Rocks as well. So just be real careful. You don't want anything that's super hard, but it needs to be hard enough to kind of, have some brushing action. And watch your pet when they're chewing on any kind of new toys or anything. Thanks so much for joining me today. I'm Shannon Yehudi, your registered veterinary nurse. If you learned something new today, hit that like button and leave a comment about your biggest takeaway or suggestions for other topics that you'd like to learn about. Don't forget to subscribe so you get notified when new videos are released.